cancer physical therapy specialist, Dr. Leslie Welke. Welcome to the Recovery Room. Today we're answering a question from Dana K. from Madison, Wisconsin. Her question is, I had a mastectomy and radiation about 9 months ago and still have a lot of tightness, and it seems to be getting worse, not better. When will this tightness go away? Thank you, Dana, for this question, as it comes up pretty often. The quick answer is yes, the tightness will go away, but for some people, it may take some work. Usually this tightness will resolve within a year to a year and a half after surgery and radiation. But for some people, it can last longer. Here's the reason why. Tightness after a mastectomy is fairly common, as it is after many types of cancer surgery. A simplistic but good way to describe why this is to say that an orthopedic surgeon opens an area, goes in and fixes something, and then closes. A cancer surgeon, on the other hand, opens an area, goes in and removes a bunch of tissue, and then closes. This can lead to scar tissue development. And then in cancer care, surgery is often followed by radiation, which can compound the tightness issue more with added tissue fibrosis. Both scar tissue and radiation fibrosis take about a year to a year and a half, or 12 to 18 months, to fully mature and stop tightening. I call this 12 to 18 month period after surgery or radiation the shrink zone. If you are in this time frame, you may notice that you stretch, you feel better, and then you feel tight again. And then you stretch, you feel better, and then you feel tight again. It can be very frustrating, but it's pretty normal for this phase of time after surgery and radiation. If you stick with the stretching consistently, once the scar tissue and fibrosis have stopped thickening and tightening, you will eventually win the tug of war. You'll stretch, feel better, and then actually stay stretched out. If you are months or years beyond your surgery or radiation and are still having stiffness or pain in that area, it's never too late to get on a good stretching program and make those symptoms go away. If you have quite a bit of scar tissue or radiation fibrosis, it can take a good 12 weeks of stretching, 3 to 5 times a week, to permanently make that tissue more pliable and longer so it finally stops bothering you. Once you have full mobility, and again are beyond that 18-month shrink zone, you should eventually be able to stop stretching the area and still be pain-free. It is rare to have long-term pain, weakness, or tightness after cancer surgery or radiation. So if you are having trouble with this, or if you need help, please talk with your cancer doctor, nurse, or physical therapist, as you should not have to live with it. Also, you can check out the Recovery Room video posted on October 3rd of 2018 titled, Do You Still Have Pain After Surgery?, as well as our other stretching videos in our video library. I'm Dr. Leslie Welke signing out from the Recovery Room. Stretch well. Let's talk again soon.